the price increases are due in part to the business practices of pharmacy benefit managers. That's the subject of today's hearing. PBMs are contracted by government programs, insurance companies, self-insured employers to negotiate on behalf of the pharmaceutical firms. And the way the system works, they also make a lot of money driving up the price on consumers.
First of all, on the DIR fees, it's really brutal what's happening to the cost of drugs that gets passed on to seniors and also to our community pharmacies. And I'm someone who thinks that the community pharmacies are an essential component in our healthcare system.
At the same time, the three largest PBMs control 80% of the health plan pharmacy benefit market and are vertically integrated upstream with the three largest insurance providers, Aetna, Cigna, and United Health, and downstream with mail order and retail pharmacies that compete directly with independent pharmacies. Vertical consolidation in our industry has created a perverse environment where one competitor sets another competitor's prices, dictates their competitors' reimbursements, uses their competitors' data to steer their patients to their own pharmacies, and limits where and what consumers can buy.
Community pharmacists like yourself work the front lines in our healthcare system in Kentucky and rural America. I know during the pandemic, you all were the first to provide COVID vaccinations and help many Kentuckians. Yet during that same time, you were having to pay DIR fees at all of your pharmacies. Now, how much did PBMs force you to pay back in 2020 during the pandemic?
PBMs play an oversized role in federal healthcare programs as large corporate middlemen. PBMs determine which pharmacies patients may choose by creating provider networks, determine which drugs patients can be prescribed by creating drug formularies, and determine how much patients pay at the pharmacy counter for their medications. Because of their anti-competitive practices and our nation's ever-increasing drug costs, greater scrutiny over PBM business practices is imperative.
We know that the PBM has a lot of control over what pharmaceutical can actually reach the consumer that is on a specific plan. And we know and are curious about some of the other rebates that are recouped from pharmacists by the PBMs. And pharmacists tell me that this is done without transparency or accountability by the PBMs.
PBM's stated goal is to lower healthcare costs for consumers through this complex system. The problem is that patients rarely see or feel the benefits. Drug prices continue to rise, insurance costs continue to eat into incomes, and more often, the drugs patients need are not covered by their health care plan at all.
I talked to a generic company. They have an insulin that's $140, but you know which one's on the formulary? The $900 one. That's a travesty, and you wonder why the cost of drugs are up and everybody's screaming at us.